Topic 1. Medical Ethics and Professionalism. 1.1. Responsibilities of Radiographer. Before a radiological examination, a radiographer has several important roles and duties to ensure the safety and accuracy of the procedure. Here are the key responsibilities. Number 1. Operate imaging machinery. X-ray technician operate the image machine, position it correctly and monitor test progress. They perform tests such as CT scans, bone density scans, X-rays, fluoroscopies and cystograms. Number 2. Patient preparation. Explain the procedure to the patient, including its purpose, what to expect and any specific instruction, such as fasting, removing clothing and jewelry. Number 3. Assist patient and their family members. These technicians offer care to patient undergoing a diagnostic test by outlining the process, answering questions and helping them to reposition or move. They also interact with people caring for the patient to offer support and explain any necessary action before and after the test. During a radiological test, a radiographer also has their own responsibilities after a radiological examination, such as maintain machinery and maintain the work area. These technicians are responsible for maintaining the machinery, cleaning it and sanitizing different parts after each test. They also troubleshoot the imaging machine when malfunction and liaise with the service provider to ensure timely maintenance. Secondly, document patient's history and records. Medical technicians usually collect information such as the patient's medical history and personal details before conducting a diagnostic test. They also share relevant data with other departments such as the billing and medical record keeping teams.
We have two definitions, ethics and medical ethics. First, ethics is a branch of study dealing with what is the proper action, right and wrong, for individuals interacting with another person. Second, for medical ethics is a branch of ethics that pertains to medical practice. It's a more regulation and ethic principle for professionals dealing with patient. We have four core ethical values. First, autonomy is obligation to respect patient as individuals, such as respecting the patient right to make their own decision regarding their health and treatment. Second, beneficence is ethical duty in patient best interest, like action that is done for the benefit to others. Third, no maleficence is the principle to no harm healthcare provider, avoid treatments or intervention that can cause unnecessary harm or suffering to the patient. Lastly, justice is to treat person fairly and equally. Fairness in providing care, ensuring that all patients receive equal treatment.
Code of Ethics. Code of Ethics defined as the rules that regulates on how members of the medical profession should behave professionally. A statement of an organization guiding principles that describe the duties and moral obligation towards the society with dignity and respect. The purpose of this code is to give members and other party rules for delivering morally sound, competent, and care while protecting patient rights and integrity in the profession. First is professionalism. Radiographer must obtain the patient consent first before disclosing information. Maintaining a positive relationship between the radiographer and patient is crucial, and the radiographer is required to give each patient individual care and attention. Second, morality. Medical personnel are guided by a principle and belief that helps them choose between right or wrong when giving care. It guarantees that a radiographer is delivered honorably. Third, good communication with patient and their family. Constantly giving patient and their families undivided attention and acknowledging their worries. Fourth, practicing radiation protection for patient, staff, and public. Always use apron to shield the part of the body that is not involved in the procedure. For instance, thyroid shield. Fifth, protect patient records. Only authorized workers should be access to specific information by providing staff training. Healthcare provider may protect patient information and reduce this risk of illegal access and data breach. The last one, confidentiality of patient information. Healthcare practitioners are legally and obligated to maintain patient information confidentially, cannot be leaked or share information without the patient consent unless compiled by the law.
Principle of medical ethics and professionalism. The radiographer should provide service without discrimination, such as sex, age, religion, status, or the disease. Radiographer must be respectful of different cultural backgrounds. After that, provide service to the patient with full respect, ensuring the patient feel comfortable and informed throughout the imaging process. Respond to the patient needs in providing quality of patient. Radiographer should provide imaging service as quickly. Limiting the radiation exposure to the patient and staff, radiographer should always use the minimum amount of radiation. Radiographer should not diagnose to avoid misinformation and misinterpretation. Radiographer should encourage them to speak to their doctor. Protect and respect the patient right to privacy and reveals confidential information only required by law. act as agent through observation and communication to obtain correct information for the physician and doctor. Radiographer should observe the patient physical state and communicate effectively with other staff and healthcare team, use appropriate equipment, correct technique and procedure to produce high quality radiograph, select the most suitable imaging equipment based on the patient condition and the physician requirement. Learn to assess a patient condition before and after each procedure to detect problems that may occur. Radiographer should understand their current health status and relevant condition. Lastly, continually improve knowledge and skill by participating in educational and professional activities which radiographer can provide hands-on experience and knowledge from the patient right, respectful and continuity of the patient care. After that, the patient must completely inform about their diagnosis, treatment and prognosis. The patient has the right to know the hospital rules and regulation. The patient has the right to refuse any treatment, but they should understand the medical consequence of their action. The patient has the right to refuse to participate in research project. All communication with patient such as case discussion, consultation, examination and treatment are confidential. Lastly, the patient has right to know the cost of their medical examination, medication, surgery and other follow-up treatment.
Topic 2. Receiving patient. 2.1. Source of the patient for radiological examination. In a radiological examination, the source of the patient typically refers to the clinical indication or reason for the imaging study. Here's a breakdown of the process. Number 1. Clinical evaluation. History taking. A true patient history is taken to understand symptoms, medical history and any prior imaging studies. Number 2. Physical examination. The clinician performs a physical exam to identify any sign that may require imaging. Number 2. Selecting the appropriate imaging modality. Based on the clinical questions, the clinician decides on the appropriate type of imaging, such as X-ray for bone fractures or certain lung conditions, CT scan for detailed cross-sectional image useful in trauma or complex diagnosis, MRI for soft tissue evaluation, neurological issues or joint problem, and ultrasound for assessing fluid collections, organ pathology or during pregnancy. Lastly, referral and preparation. The clinician prepares a referral or order for the imaging, specifying the area of interest and the suspected condition.
2.2 Patient registration process and distribution of examination in medical imaging department. So now I will explain about the patient registration process first. So we will collect their personal information such as name, ID or passport number and their insurance detail. If the patient has the insurance, optional for them to use it or not. And then we will enter their information into a system called Hospital Information System or known as HIS, or we will enter their information into electronic medical records known as EMR. So after we complete the register, we will do a referral validation. So in this referral validation, it is to confirm the imaging order requested from the doctor in charge. We will ask the type, purpose and if there is special instruction given from the doctor. So the radiographer will do the right things and will smoothen our work with the other department. In this preparation, we will provide instruction advance from the date of the appointment or before the day of examination is going to carry out. So if the patient is going to carry out CT scan around their abdominal area, we have to ask them to fasting a day before their appointment. We will also inform the patient about preparation requirement. For example, remove their metallic objects such as bracelet, earring or something that will gonna destroy the image. Now, I will explain about the distribution of medical examination. First, we will review the order requested from the doctor in Radiology Information System, or the short term is RIS. Request order will also given to the radiologist for accuracy and necessity based on the patient condition. If there are urgent cases such as trauma, emergency and life-threatening condition, we will prioritize the cases over the routine examination. So the cases is gonna immediately carry out. Second, we will do a preparation. For the preparation, it is depend on what type of the examination. If they are gonna carry out CT scan or MRI, the patient may need to consume a contrast agent. If the patient required a specific positioning, we will brief the patient on how to prepare. So the radiographer are the one to ensure the patient for positioning and equipment setup. We will also remind the patient to remove their metallic object from their body, such as bracelet, necklace, earring, and the others that will gonna disrupt our process in taking a photo of their body. For the imaging procedure, this will be performed by trained radiographer using specialized equipment. So radiographer will be emphasis on safety and comfort for the patient care. So the patient will be comfortable and will be prepared mentally or physically for their examination. And third, for the post-imaging process, once the imaging procedure is complete, the image will gonna store electronically in the picture archiving and communication system, it known as PACS. PACS. Once it done, we will prepare the report and the radiologist will diagnose the condition of the patient. So the result will be sent to the referring doctor that the request of the examination to carry out, and then the doctor in charge will discuss with the patient for their next step of their treatment.
Okay, for 2.3, identify the types of X-ray room examination based on types of examination. For the first one is diagnostic radiography. First one is general X-rays. This is a routine X-ray examination in which image of parts of a body such as bones, chest, and abdomen are taken. Okay, for the second one is fluoroscopy. The technique provided a live image and make it possible to visualize the functioning of the organ. Is it useful in performing various swallow studies of the esophagus and upper gastrointestinal studies as well as in catheter guidance? Okay, so for the second one is interventional radiology. So, interventional radiology is image analysis, particularly X-rays to facilitate the use of non-invasive techniques including biopsy, catheter placement, embolization. So for biopsy, this refers to take tissue sample from various organs aided by imaging so as to ensure accuracy. For catheter placement, this is the placement of tubes or other device into blood vessel or an organ for the purpose of diagnosis of treatment. So the next one is embolization, the blocking of the blood supply to a particular part such as a tumor using materials directed under X-ray. Okay, for the third one, we have computed tomography, which is CT scan. So CT scan use X-ray to obtain detailed three-dimensional image of the body. It provided a lot more information than radiographic X-ray imaging and is mainly using for the following diagnosing internal trauma tumors and disease in the abdomen, chest, and head. The next one is performing procedures such as biopsies and placing drains which need to be monitored. Okay, the next one is mammography. So this is, however, a breast X-ray examination, which is one of the type of the diagnostic method, and is performed for determining percent of preclinical stage of breast cancer among women in the target population. Having some follow-up screen on mammogram for some abnormalities noticed during the screening test or during physical examination. Okay, for the dental X-rays, this is procedure is known as dental radiograph as well, and it's concerned with imaging of the teeth, gum, and the area around them. Type include is bite wing X-ray, the periapical X-rays, panoramic X-rays. Okay, for the next one, which is the sixth one, is pediatric X-ray. These are normally pediatric X-ray examination designed for children, such as included the use of lower radiation level. Is it also performed with fast imaging system due to the physiological nature of children, which makes them unable to stay in one position for a long time. Okay, for the next one is mechanically the portable X-ray. The portable X-ray units are like logistic contraption that are constrained to obtaining pictures for clinical evaluation when the subject is on the bed. This also helps people who are unable to move around. Okay, for example of the other studies on skeletal parts that can be traced within this X-ray is skeletal surveillance, which are a sequence of related complete X-ray studies. In most instances, the examination of the lesions or pathology of the osseous structure system is the primary purpose of this type of X-ray. Okay, for 2.4, explain the types of X-ray examination that need appointment. So, for the first one in CT scans is computed tomography. This provides very detailed image and requires specific preparation like fasting or hydration. Okay, for the next one is bone density scans. These measure bone strength and are scheduled to allow for proper preparation and equipment availability. Okay, for the next one is interventional radiology procedures. This can involve X-ray guidance for biopsies or other procedures are required and appointment setup. Okay, for the last one is specialized studies. Any X-rays that requires the use of contrast material usually needs prior shielding to managing timing and preparation.
2.5, the flow of appointment system for inpatient. Inpatient is basically the patient that stay in ward. So firstly, the X-ray form will be filled out by the doctor in charge. So if there are emergency cases, either from emergency department, ward, or clinic, the doctor in charge will see the radiologist personally to discuss about the type of examination, and radiologist will sign the X-ray form if they confirm about it, and they will carry out the case immediately. And after the X-ray form complete, the ward staff will send the X-ray form to the X-ray counter together with their appointment book. So X-ray staff give the X-ray form to the radiologist whether the request examination is approved or not. Basically, X-ray staff is radiographer. If the examination is not suitable with the patient pathology, the radiologist will suggest the other suitable examination to the doctor in charge. Once the examination is decided by the doctor and the radiologist will sign the X-ray form to carry out the examination by the radiographer. So, X-ray staff will record all suitable date and time for the examination in their appointment system. Next, X-ray staff will record all the patient information such as patient name, registration number, from what ward they are, and time of the examination, date and time according to the specific modality. Then the staff nurse in ward will prepare the patient before examination, such as blood test, fasting, bowel preparation, drug if the patient has allergic, and intravenous line. So lastly, the X-ray staff will record the appointment date and time in ward appointment book and give it back to the nurse in charge of the patient. So that's it for the in-ward patient. Now, for the appointment for outpatient. First, the X-ray form will be filled out by the doctor in charge in clinic, and then the patient will bring the X-ray form that complete to the counter together with their appointment card. And next, X-ray staff will give the X-ray form to the radiologist, and then the radiologist will decide whether the request examination is approved or not. If the examination is not suitable with the patient pathology or patient condition, the radiologist will suggest other suitable examination to the doctor in charge of the patient. So once it confirmed about what type of examination is going to carry out, so the radiologist will sign the X-ray form. And then X-ray staff will record the suitable day and time of the examination in the patient appointment system. So the X-ray staff will record the suitable date and time of the examination in appointment system. After that, X-ray staff will record all the patient information such as patient name, registration number, type of the examination is going to carry out, the date and time according to the specific modality. So X-ray staff will record the appointment date and time in patient appointment card and give it back to the patient, so the patient will know what date and time for them to come to the hospital to carry out the examination. And X-ray staff, or basically radiographer, will explain the patient preparation clearly, such as fasting, bowel preparation, drug if the patient has allergy. Lastly, we will remind the patient before they go to contact the X-ray department if they cannot come on the day of their appointment. So we will give a new date to them, and then it will be carried out immediately on the day of the confirmed dates of the
Point 6 describes some patient preparation before radiological examination. Patient preparation before radiological examination involves patient who will undergo radiological tests. For example, patient who will undergo computed tomography, CT scan, magnetic resonance imaging, MRI, and related. There are some things and procedures that the patient needs to do before undergoing the process involving radiological examination. Firstly, the patient needs to inform to the medical staff about the full medical history, including the allergy, if they have any, previous surgeries, current medication, and if the patient was female, need to inform the radiologist if they are or not pregnant. This step very important because if the only one step not to be followed, the step will cause consequence to the patient. Secondly, for some procedure, patient needs to fasting 4 to 6 hours before attending the exam like CT scan and MRI. This is because patient need to reduce the presence of food in the digestive system. Some hospitals have the patient with ice chip to reduce the craving of food and drink. There are also procedure patient will be advised to drink water to fill the bladder. If this is because to improve the image quality for pelvic perfusion. 247. Explain the patient care before, during, and after radiological examination. Firstly, the patient care before radiological examination is have a patient consent. Informed consent is must, so especially for procedure with potential risks, such as those involving contrast agents or radiation exposure. The team also need to provide instruction to the patient. For example, explain the expected duration and any routine or position. Secondly, the patient care during radiological examination is to make sure the patient is comfort and safety. The team need to ensure the patient is comfortable and in correct position for the imaging study. Communication is also the key. Reassure the patient throughout, explaining what is happening and encourage them to stay still during examination. Lastly, the patient care after radiological examination is hydration. I advise the patient to drink to help to flush out or contrast agent if need. The team need to document the procedure, any adverse reaction, and any instruction provided to the patient.
Hospital Information System (HIS) and Radiology Information System (RIS). HIS is defined as a computer network which manages hospitals' operation, including medical records, administrative, financial, legal aspect, and also corresponding processing services. In many implementations, HIS is a comprehensive integrated information system that are designed for managing the aspect of hospital operation. HIS is also known as Hospital Management Software (HMS). HIS functions are storing and retrieving data, facilitating communication, and support decision-making. RIS, a radiology information system, is a software system that manages and stores medical imaging information and controls the workflow of a radiology department. RIS are often integrated with an Enterprise Master Patient Index (EMPI), which store patient demographic data and serve as a single source of patient identity. RIS functions are patient scheduling, imaging performance, and also reporting. Describe the Picture Achieving Communication System (PACS). Picture Achieving Communication System (PACS) is a medical imaging technology used primarily in healthcare organizations to securely store and digitally transmit electronic image and clinically relevant reports. PACS technology is becoming more important as the volume of medical image grows throughout the healthcare industry and sophisticated data analytics of image become more prevalent. Function of PACS may be used instead of hard copy film and management of physical activity. Enables clinicians in different locations to review the same data simultaneously in order to collaborate on a particular case. Allow radiologists and other radiology, also medical personnel, to streamline and manage the workflow of patient exams.
The conclusion: effective management of patient is a complex and dynamic process that requires an integrated approach that is focused on the patient. It consists of through assessment of the case, correct diagnosis, therapy correlated to the patient, monitoring and counseling. It becomes important to stress the need for teamwork among healthcare personnel as this enhances the fulfillment of the partnership and cooperation philosophy of patient care that leads to enhanced satisfaction in patients' outcome. Moreover, the application of EBP and intervention technologies like EHR system may increase the effectiveness and quality of the work. In essence, there is trust, caring, and strong dedication towards improving patients' health and quality of life, and this marks the effective management of patient. Thank you.